Good morning, good afternoon, good evening from wherever you are joining us from today. Welcome, everyone. I am Jackie Malouf from Lebanon. I am the founder and president of the National Diabetes Organization, Dialab, in Lebanon, and very proud to be the vice president of the International Diabetes Federation, serving a second term. Also, the co-chair of the Youth Committee, serving on this committee for a second term in the row. It is truly a pleasure to welcome you all to this very important session on healthy schools, healthy futures, and about the International Diabetes Federation Kids Program, which is a key initiative that brings diabetes education directly into schools where awareness and understanding can begin at a very early age. As we all know, education is one of the strongest tools we have in diabetes prevention and care. And by introducing the right information to children, teachers, and parents early on in life, we are not only raising awareness, we are helping shape healthier generations who can recognize symptoms, understand lifestyle choices, and show empathy and support toward classmates. The IDF Kids program has been implemented in schools across several countries, including Lebanon, through our program at Dialab entitled Diabetes in the Classroom. And it is a powerful tool that we wish will be disseminated more and more across the world. We will see it throughout the presentation. And today we will hear from distinguished experts and practitioners who have been leading this effort on the ground, sharing their experiences and why not, maybe some challenges and best practices in implementing the kids program in different parts of the globe. I'm also very happy to share that the program material have been recently revamped and very honored to be part of the committee who reviewed the new materials. And that was a great privilege. And the new resources are designed to better reflect the latest evidence, integrate interactive learning, and ensure that every child, wherever they are, can receive accurate and age-appropriate information about diabetes. So, as we move through today's session, I invite you to think about how we can each play a role in expanding the reach of this program and how empowering children with knowledge can lead to more compassionate, diabetes aware schools and communities. And I believe it's very easy. We all live in places where we have schools around. Just making one session in a school could be a great start. So I invite you all to think while you listen to our keynote speaker, participants, and panelists later on how you can do something near you, in your own school, in your own community. I would like to thank each and everyone who has joined us. In some parts of the world, it's very early. In some other parts, it's very late. So thank you for joining us today. And I really look forward to an inspiring and very insightful discussion with our guests today. Before that, I would like to move to some housekeeping information for all of you to know that this webinar will be recorded. You can activate Zoom generated subtitles if you need to do so, and you do it by clicking on the closed caption, it's a CC button at the bottom of your Zoom window. Try to take a look now in case you need it, and note that the subtitles can never be 100% accurate, but of course they can help if that is the case. And the recording, slides, and the feedback questionnaire will be sent to all registrants within the coming few days, as we usually do when we have our sessions at IDF. The participants can have to attend 80% or more. We invite you to attend, of course, 100%, but you need at least 80% of the event to be attended in order to obtain your certificate of completion. And you also need to fill the feedback questionnaire. So please check your spam folders. Sometimes if it's the first time you are receiving something, it may go to the spam folder. And if you have not received them by 6 November, please contact advocacy@idf.org. And for use the Q&A function to post your questions. We are very much looking to a very interactive session, and we look forward to receiving your questions. So without further ado, let me introduce our keynote speaker for the day, who is from ISPAD or ISPAD, Dr. Eduardo Cagliari. We are very pleased to have you with us today, and you are the coordinator of ISPAD Special Interest Group about diabetes in schools. You are the president-elect for ISPAD meeting Rio de Janeiro 2026, and you are assistant professor in Santa Casa School of Medical Sciences in Sao Paulo, Brazil. Dr. Cagliari, the floor is yours to give us your keynote address.
Well, thank you so much, Jackie, for this kind introduction. Hello to everybody, wherever in the world you are. I'm here representing ISPAD. ISPAD is the International Society for Pediatric and Adolescent Diabetes, and ISPAD's been on the way since 1974 when it started as a study group of diabetes in young people. And now it's the only global society focused specifically in all types of diabetes in young people. Our mission is to advocate, to advance clinical and scientific knowledge, and to promote education for better care and treatment for young people with diabetes. ISPAD has been an IDF partner for a long time, since its beginning, I would say. And it's working together with IDF on KiDS program for more than 10 years now. I remember because I participated on the launch of KiDS program in Brazil and India 10 years ago. And that start was very important because it started to be the only and probably the first and the only global program regarding diabetes in schools. We know that our children spend most of the daily time of them inside schools, and they need better care for them to learn and for them to take care of their diabetes when they are at school. So we believe in ISPAD that KiDS material is fundamental for people in schools to learn about diabetes, and for children and families to know how to take this message to schools. So ISPAD, and especially the special interest group in diabetes in schools from ISPAD, is participating in the formulation of KiDS material. We are discussing with them about the content, and we are very committed to this topic of diabetes mellitus at school. We at ISPAD, we developed also a guideline which is free online. Inside our guidelines, we have a specific chapter of how to deal with diabetes in schools, which we understand is difficult, is different from doing everything at home. And when you go to school, things are different, and you have to have teachers and many people from school staff to deal with that diabetes. So we developed those guidelines, we developed position statements, and we are now working on surveys to understand what is the perspective of healthcare professionals and families regarding diabetes care inside schools. So we are launching now in our ISPAD Congress in Montreal in November one of the results of this research, which studied more than 77,000 families and their perception about diabetes. More than 50 countries are represented. And we see that the families, they are not very satisfied with what's going on inside schools. More than half don't have a staff member which is specifically trained to deal with diabetes, and they are reducing work hours to deal with diabetes during school hours. So we understand that it's our mission, both from ISPAD and from IDF, to develop this material, and we believe that KiDS is the material that has to be used globally, so we are very happy to contribute with that. So we are here to discuss and to confirm the willingness of ISPAD to work together with IDF during this KID program. And we believe here really that this program is probably the most important program to bring knowledge about how to make diabetes care inside schools, how to make school be a safer and happier place or happy environment for children with diabetes inside school. So we are very happy to be here, and we are willing to participate on the discussions. ISPAD and IDF have to work together, and KIDS program is really one of the most important programs where we can reach these objectives together.
Thank you so much, Eduardo. And you mentioned something that I really would like to repeat. The study was done on 77,000 families, which tells us that when we have a child living with especially type 1 diabetes, it's the whole family we need to collaborate with and engage with in order to really get to the best outcomes. It's the family, the school, the whole environment. And this is something very important. I can only commend on the work that ISPAD is doing and cheer for this collaboration between IDF and ISPAD and wish for it to grow and continue in the years to come for the benefit of everyone living with diabetes across the globe. Thank you once again, Dr. Cagliari. And now we move on within our program to have another keynote address, this time from Sanofi, who is our supporter with this program, with Ms. Eva Kofi from France. And we welcome you on board, Eva, and the floor is yours to do your intervention.
Thank you so much, Dr. Malouf, and good morning, good afternoon, good evening to everyone on the phone. It's so exciting to be with you here today. At Sanofi, our teams rally behind a shared purpose, which is chasing the miracles of science to improve people's lives. We strive to advance innovation and foster equitable and sustainable access to healthcare around the world. We're a committed partner in diabetes care with over 100 years of expertise in the field. Our aim is to not only transform the way diabetes is controlled and treated with medicine, but also holistically. We believe diabetes education is critical for individuals living with the condition and those at risk, as well as those who care for them, teachers and schools included. We are very proud to have been supporting the KIDS program since its inception in 2013, partnering with the IDF and ISPAD to bring diabetes educations to schools around the world and reaching over 1 million children in 23 countries so far. We've seen the tremendous impact the program can have on children, teachers, and families, creating a more supportive environment, combating stigma, and fostering the adoption of healthy behaviors. You'll be hearing about some of these experiences in China and Egypt in a moment from some of the program partners. Partnership is truly at the heart of the KIDS program, and we have seen that it's most effective when all stakeholders come together: diabetes advocates, health authorities, education authorities, scientific societies, patient groups, and of course, teachers. As we know, diabetes has a significant impact on many aspects of a child's life and how they experience childhood. It's so important to provide them with the support they need so their diabetes is well managed, but also so they get the most from their education. As a mom of 2 young children, I know all too well the important role teachers and the broader school system play in helping our children reach their full potential. A couple of weeks ago, I was reading an article about a mom in Canada keeping her 6-year-old diabetic daughter home from school because it's no longer providing the support needed to monitor her condition. The mom was explaining that she tried to educate her daughter Summer on diabetes management, but obviously she's not in any way, shape, or form capable of doing it all by herself. While we know this is a terrible choice that a parent would have to make, it remains the reality for far too many. I believe this one example really shows the importance of kids and strengthening diabetes education in our communities. Let's ensure all children benefit from a supportive environment at home and in schools. We look forward to continuing to play our part here at Sanofi through important partnerships like this one. Thank you again for having me, and I'll turn it back over to Dr. Malouf.
Thank you so much, Eva. I cannot say how important your support is to this program. And actually, I would love to be optimistic enough to think that the partnerships you have will expand to more countries, supporting more member associations with IDF in order to better implement this program and to leverage on what's being done and all the on the beautiful material that with your support has been elaborated in order to really make millions of people benefit from this wonderful program. So thank you so much for the support, and the thanks goes to your company, to Sanofi. But again, we look further to more support and to more impact. Thank you, Eva, for being with us and for talking about this. I would like to say that we have crossed the barrier of 500 attendees. I was counting 27 countries, then I stopped counting because I needed to focus on the rest of the presentation. Thank you to each and everyone who joined us today to really benefit from the insightful conversation that's happening here. And now to set the scenes on the topic of today, on what we will be talking about, let me take you over to the journey of the diabetes program. And again, I'm very proud to have started in Lebanon to implement it with the support of our young leader in diabetes. And the material are really, really great. I invite all of you to check the website, the IDF website, and the kids program details and information. You will find very useful resources there. And the whole program aims to bring diabetes education to the schools to fight diabetes-related stigma, which is a topic that needs a webinar by itself, maybe, and to promote healthy lifestyles and to tackle the modifiable risk factors for type 2 diabetes as well. So, if we want to talk numbers, since 2013, the early beginning of the kids program, when it was born, until today, the resources have reached more than 1 million students across the world in 23 countries. And we are looking definitely with your help to see those numbers grow exponentially very soon using the resources that we are providing. And in Bangkok, in April, during the World Diabetes Congress that the IDF does every 2 years, we witnessed the launching of the new material, the revamped material of the kids program. And again, I was very proud. It was a privilege to be part of the people who looked over this material and reviewed it in order to make a greater impact. And it includes new branding, new logo, and all the revamped resources. They are all on the website. I really invite you to take a look at them, to make good use of them. Instead of reinventing the wheel, you can maybe translate them. You can use all these resources to make an impact in your own city, in your own school, in your own environment. The objectives are maybe clear to too many of us, but it's a global perspective with these materials. But the important is that they can be transformed into a local context, keeping the core values of whatever we are talking about here within these materials. So again, it can be contextualized to your own country, maybe to your own language, to the different cultures in different parts. And I understand, for example, if it's implemented in South America, it's different than implementing it in the Middle East, as the type of food may vary, the culture may vary, certain language need to be updated, but keeping the core, you can really translate it and transform it into your own local context. And the 2027 goal would be a roadmap to guide national implementation and share best practices to be launched at the IDF World Diabetes Congress to happen in Doha. So it's like a challenge. Let's take it as a personal challenge. Use all our passion-driven commitment to really implement this program furthermore in our schools, in our communities. And you can find the resources. You can either scan them here for easy access. You have the information pack, the well-being guide, the Tom and Friend Diabetes Journey comic book. They are really friendly, user-friendly, and easy to implement. We are making it very simple to implement it. So now it's up to you to make good use of these resources. And again, they are all on the website for easy access for all of you to download them. You can even print them, you can translate them to really make leverage on whatever has been done until today in order to enlarge the implementation of this program. So again, you have the implementation guide. You have a class plan 1 and class plan 2 that could be used by maybe a teacher, maybe the nurse at the school, maybe an NGO who is visiting the school to implement. And especially we rely on our young leaders in diabetes, our Blue Circle voices, and you will hear from some of them later on today and how they have been implementing this program. So again, wonderful material prepared by professionals, practitioners, and reviewed by the youth committee at the International Diabetes Federation for you to use. The kids pilot in Maharashtra has been a good example, a success story to follow. And with the support of the Blue Circle Diabetes Foundation, which is India's largest patient-led diabetes organization and support group, it has been implemented, and they are testing the revamped kids resources information to gather feedback on the clarity of the implementation guide. Feedback is very important. This is a key part of it. If you can collect feedback whenever you implement using these resources, it will help us make it every time better and better. And to test the two class plans that I mentioned earlier, class plan 1, class plan 2, and also to test the impact measuring protocol and its reporting method. This is also a key point, how to measure the impact of what we are doing and to report about it. So the preliminary figure from this pilot project is 22 kids session piloted in 11 schools, like 2 sessions in each school, and over 4,000 students reached. We do know that reading numbers is easy, but getting to those numbers is not. So really big shout out to the people who are implementing this in India. And we're very happy to see that 4,000 students have benefited from that. Now, for the upcoming activities, we heard from Dr. Cagliari about the ISPAD 2025 happening in Montreal, Canada. And I'm really happy to have our young leader in diabetes attending this soon when it's happening. And so many activities happening there that will show the strength of the collaboration between IDF and the ISPAD. Um, you will have it present there. All those of you who will be attended, make sure you pass by, you see the material, you wait for it, you attend when it's being spoken about in order to reinforce whatever you know about the program as yet and know more about it so you can implement it. There will be production of new kids resources for adolescents about from 14 to 18. So now it's for the younger children. We are tackling soon. We will start the production of the new kids resources for those between 14 and 18 years of old of age. And also, there will be a second season of the podcast. We want your support for it. and the podcast name is Doing Well with Diabetes. We have to keep up with the advances of technology and the social media and all that, and we're trying our best, but with your help, we can really make the impact greater through your dissemination of whatever IDF posts related to this program and any other program. So help us disseminate about it. And when the podcast starts again for the second season, we want to count on your support for it as well. So let's move on with our program to welcome now two guests, Mr. Jin and Mr. Wang from China, to tell us more about the kids program implementation in China. We heard from Sanofi that they are supporting this implementation, and we want to hear about that. So, Mr. Jin, the floor is yours. Let us know about how the implementation is going, and I understand that Mr. Wang will continue with the presentation. So please go on.
Thank you. Hi, everyone. My name is Jin Shen. I was diagnosed in 2001, and I have lived with type 1 diabetes of 24 years. When I was young, many people did not understand my disease. In China, with children getting family face feel stress and many problems. This is when I started sweating. In 2019, I built Sweating in Shanghai. This is sealed only NPO in China that helps children with diabetes. Our mission is simple, give children and families technology support and college. In 2024, kids come to China. I was very happy because the goals of kids are the same as the goals of the suite. We worked together and made the project better of China. For my own fight with diabetes and my work with sweating, I believe one thing the best way to fight a misunderstanding is to talk, to educate, and work together. Now, I would like invite Jerry Wang to share more with you. Thank you.
Well, hi everyone. My name is Wang Zijie. You guys can also just call me Jerry. And I'm currently a student at New York University, majoring in applied psychology and data science. Well, same as Mr. Ding, I'm actually also a type 1 diabetic, and it's been a part of my life for almost 10 years now. And going back to why we joined this program, I like to build on what Mr. Ding said. You see, me and Mr. Ding actually always like using the analogy of rain. When we were first diagnosed, we were lost and vulnerable. And so back then, we were kind of just like completely exposed to the rain. But then as we learned how to cope with it, we began forming our own support networks. And for me, that moment actually came when I first discovered Mr. Jing's Sweetie group. And from then on, I knew I had an umbrella over my head. And as we get more experience and become an individual that knows how to live with type 1 diabetes and maintain a mutualistic relationship with it, we realize it's actually now our turn to hold that umbrella for others that are still out there. And that is basically the idea that what drew me into applied psychology as well. So I'm actually very grateful to have joined the Kids in China project and as one of the volunteer leaders, not just to apply what I've learned, but also to take part in a mission that we all share collectively and brought all of us here today, and which is to hold that umbrella for those that are still out there exposed to the rain. And so without further ado, let's take a step back away from my story and Mr. Jing's story, and let's look at the bigger picture over here. How does the Kids in China program fits into the current situation in China? Well, moving on to the project background, well, right now, China has around 620,000 people living with type 1 diabetes, ranking third in the world. And what's more concerning is that this incidence rate has quadrupled in the past 20 years. Well, on the bright side, there's definitely been major improvements. We have better medical access, treatment availability, and care infrastructures. But despite these hardware improvements, the challenges we face today manifest in a different form. The psychological burden of managing diabetes every single day is still heavy for many families. And honestly, a large part of that comes down to the lack of public awareness. Many people still really don't know what type 1 diabetes is, and that misunderstanding can turn into stigmas. under this social climate, I feel like it's very hard for people with type 1 diabetes to kind of ignore this almost like sense of shame as they are just labeled to be different. So as for the Chinese government, they also have kind of like recognized this as well through initiatives like the Healthy China 2030. It aims to improve health literacy and chronic disease management, and that's exactly where our program steps in as well, to connect education, community, and empowerment all together. Next slide, please. Well, so what exactly is KiDS in China? Well, it is a collaborative initiative led internationally by the IDF and ISPAD, which I'm sure I don't have to talk more about. And but locally, we work closely with the Shanghai Songqingling Foundation. They are basically a public fundraising foundation that focuses on women's and children's health, and they're the key to making our program localized and truly rooted in the Chinese context. Well, the program has three main components. First, the Kids in School program. This is basically the heart of what we do. We educate teachers, peers, and communities to build a knowledge basis to alleviate misunderstandings and make schools safer and more inclusive for students with type 1 diabetes. And secondly, we have the Kids Camp. We go deeper over here by supporting newly diagnosed children and their families as they adjust emotionally and practically. And last but not least, we got the Kids Online podcast, which I find fascinating because we just took it online and we reach a broader audience base and a self-paced learning curve that makes our material accessible anytime, anywhere. Next slide, please. And this is basically a glimpse into the program. And as you can see in the pictures, Mr. Jing is also like having a great time. And also that's me. I was like delivering a speech at one of our kids summer camps. And for the picture in the middle, it is basically our Kids in School program. And then on the right, there's also a lovely photo of our volunteers. And they are also very happy to be a part of this as well. And next slide, please. Well, so to briefly look at the impact we've made so far, our project brings together hospitals, schools, and patients to create a more connected and supportive system that works toward a type 1 diabetes-friendly society. And to put these achievements into numbers, in 2024, we reached 4 provinces, hosted 5 events, and engaged over 200 participants. And by 2025, these numbers grow by more than double. We reached 10 provinces, 12 events, and over 500 participants. With these promising results, we think there's a lot to look forward. Our next step is to actually go even broader, but with a clear strategy though. We're adopting a train-the-trainer model and healthcare. That means that we're going to train experienced educators and healthcare professionals so that they can go on and lead on their own workshops locally. And this way, we can expand our reach sustainably and continue building a truly type 1 diabetic friendly society across China. And that'll be all from us. And thank you so much for listening and for being part of this conversation that really matters to us.
Thank you so much for Mr. Jin and Mr. Wang. It's really inspiring to see how two people living with diabetes are thinking not on only their own diabetes management challenges, but how to help others. And we can see the impact you are creating. So congratulations on this beautiful project. And on the podcast, we wish you all the best of luck. Keep creating the impact we are looking for. And thank you for being with us today. So as we move on with our inspiring program of the day, we will be talking now to Professor Mona Abdelkader Salim from Egypt, who is a professor of pediatric diabetes and endocrinology in Ain Shams University. She is also the president of the Egyptian Society of Pediatric Endocrinology and Diabetes, ISPAD, in Egypt. Dr. Mona, we are honored to have you with us today, and we are looking forward to hear your insightful presentation today. Please go ahead. The floor is yours.
Thank you very much. I am really honored with being with you today. Diabetes is a significantly prevalent disease in Egypt with serious clinical and economic burden. According to the last IDF, the 11th release, between 13 to 15 million adults will be having diabetes, and 22% of the Egyptian population have diabetes. And there are estimated to be 191,000 child and adolescent with diabetes. Of course, this is an economic burden. It's $3 billion per year. And the deaths that are 72,000 per year. And this is very bad. Next. Yes. Our journey starts long time ago, from 2017 to 2020. We started in unprivileged areas in Egypt, Fayoum and El Malk, and we entered 35 schools, and we taught 173 teachers, 20,000 children, 21 parents. And the health insurance and our society take part. Of course, we taught the parents, children, and teacher with the help of IDF books translated in Arabic and very simple and illustrative books. And this helps out a lot. But we have to stop because of Corona. Then we restarted again in February 2024. We taught NGO everything about diabetes, signs, symptoms, types of diabetes, carb count, what to do in emergency. And we ask them before they start the teaching course and after. And we evaluate their readiness to teach others. Then we started in Minya, unprivileged again place in Upper Egypt. We started by 20 schools and 400 teachers. And then we asked pre and post campaign questions, and we wrote the paper about this and delivered it to IDF in the last IDF in April 2025. Next, please. Next, please. Yes. No, the other one. Please, yes. This is the total beneficiary till 2020. El Fayoum, 35 primary school, 170 teachers, and El Mark, 20,000 child trained and 21 parent trained. Then when we reached the media, the number of schools was 83. Of course, we couldn't reach the schools without the help of Ministry of Education and health insurance and the NGOs. They helped us a lot. Next, please. This was a revolution. The first decree for diabetic children was prepared by the health insurance. It was written in Arabic and English and distributed all over the schools in Egypt. They give the diabetic child the right to eat anytime, to go to the toilet anytime, to ask for help if he has hypoglycemia or hyperglycemia, and to help him by giving him supportive care, and to ask his parent to come or refer him to hospital if there is anything urgent. Next. Next, please. Yes. And we try to evaluate what is the impact of KiDS program on enhancing diabetes-related knowledge among parents and teachers, as well as assessing the influence in promoting positive behavior changes. Study data randomly, we take 500 parent, 100 teacher randomly selected. And there was a post-campaign awareness assessment done in 91% of them. Next, please. Yes, please. Yes. And the pre-campaign was done from October 23 till November 24. And the post-campaign was between December and January, and the methodology was quantitative interview with the parent and the teacher. Next, please. Yes, the males were 17% and the females were 83%, and the education was between medium and low. And the families, 26% of them have history of diabetes. Next, please. Yes, and the green arrow shows that the significant increase in awareness about diabetes. Next, please. Next, please. Of course, today is the Teachers' World Day, and we take care of the teacher and try to assess the degree of the information they got. Before the campaign, 47% of them only have idea about how to behave if the blood glucose, how to measure the blood glucose. But after the campaign, 76%. Before the campaign, again, they didn't know that if they give fast-acting sugar, the child will be okay. But after the campaign, 52% have the idea of giving good fast-acting sugar. Of course, the awareness number for diabetes type became 83%, which is a very good number. Next, please. Next. The results incorporated health-focused topics were new, but in 79% of the teacher, they have now the healthy food, diabetes disease, physical activities, the importance of physical activity, and the attitude was completely changed toward diabetic child by 86% and become aware of good things for the child to do, healthy food, physical exercise, and the school environment is very important. There is no bullying now. The attitude became more understandable and more loving, giving exceptions and excuses for the diabetic child. To conclude, the KiDS program awareness have demonstrated a statistically significant impact in improving diabetes-related knowledge and fostering healthy attitude and behavior among both parents and educators in Upper Egypt. Notably, there was an increase in awareness of diabetes type symptoms and management, positive shift towards household behavior, healthy diet, and increased physical activity, and improving facial readiness to help, because the teacher was afraid because of lack of information. Of course, this is not the end. We are planning to cover all over Egypt, and we'll concentrate on areas, unprivileged areas, but this program should be continuous with, of course, your help, Sanofi help, our society help, health insurance, and Ministry of Education. And that's all. Thank you very much for listening.
Thank you so much, Dr. Mona. A very insightful presentation. You mentioned many things that called my attention. I would like to stress on a key point that you mentioned, which is the strong collaboration between the ministries, because we need policies in order to access schools, between the NGOs that need to be working on the ground, and of course, the collaborations of the school system themselves. And also you mentioned Teachers' Day in many parts of the world. In some other parts, it has a different date. So hats off to all teachers, and happy Teachers' Day for everyone who's listening. I would also like to share that we are around 600 attendees by now, and I would like to remind you that only if you attend 80% of this webinar, you will be entitled to get your certificate of attendance. But don't stay because of the certificate. Stay because this is a wonderful session where we are listening to incredible speakers from across the globe sharing their insights about how they are implementing the KiDS program. And now we have a very interesting part in our session today, which is the discussion panel, where we have incredible speakers. Can we have that slide? Thank you. I would like to say that our speakers today, those incredible ladies that you see, Lurina, Jostana, Carrie, and Sobia, from different countries, different backgrounds, share one common thing. They are all either Blue Circle voices with IDF or young leaders in diabetes with IDF. This tells us how important those programs are, and look at those beautiful experts who will be sharing with us today their insights about the KiDS program. I would give each one of you, starting with you, Lorena, in the order you are on the screen, to introduce yourself the way you would like us to see you and look at you and why you are with us today. In 1 minute, please, each one of you. Lorena?
Thank you so much, Jackie. Hi, everyone. My name is Lorena Ferry. On social media, you will find me as the Glucose Glitch. I'm a global diabetes advocate from South Africa. I'm also part of the DDoc Voices Network. I was diagnosed with type 1 diabetes at the age of 16, and it is now 25 years later. I do educational work in schools where there are children living with diabetes in the school specifically. So I created an educational game to teach kids about the warning signs of diabetes, but mainly to focus on the warning signs of low blood sugar, because that's an immediate threat in the classrooms and on the playground. So by using the game, we teach them in a fun and interactive way. But we notice it's also very helpful when we speak with academic sessions with our doctors, our endocrinologists, the dietitians, whoever touches the game, they want to be more informed and they want to learn about diabetes. And by doing that, we infiltrate in a fun way, and we make sure that the facts about diabetes are given in a fun and in a way for them to always remember that they combine it with a tool.
Thank you, Lorena. Let's just stick to presenting yourselves now, because we want to hear all about what you are doing throughout the discussion. Jostana, please.
Hi, everyone. I am Jyotsna Rangeen. I am a person living with type 1 diabetes and completed 10 years this year. And throughout my advocacy journey over the years, I've seen so many brave, resilient children whose courage really inspire me every day. But their struggles are not just limited to managing their condition. It is the silence and stigma that surrounds it. So many children, even today in a country like India, still have to go through that stigma and misconceptions in school, because it's mostly they're asked to hide their condition. They are scared to take their insulin, and they're scared to talk about it openly because they don't get that supportive environment in schools. So one of these stories that I want to share about a girl who was expelled from her school because she got diagnosed with type 1 diabetes, and her mother was running door to door pleading and asking for help so that her child can get the right to learn. And this is a stark reminder that awareness and empathy aren't just optional. They are much, much needed in our environment, and especially for any child living with type 1 diabetes. That child deserves the right to be seen, heard, supported, and to be provided an inclusive environment where they can truly and fully thrive. And that's the kind of message that we want to leave today through this panel discussion.
Thank you. I can see our speakers are eager to start the discussion. Let's just introduce yourself in 1 minute and we will go on with the discussion. But I love it. I love the passion behind your talks, because you can't wait to share your stories. So Carrie, please introduce yourself.
Hi, everyone. I'm Carrie Murphy. My husband and my 11-year-old daughter live with type 1 diabetes, in addition to my sister-in-law and her daughter. My 2 adult sons each have positive antibodies for type 1 diabetes. 6 years ago, when my daughter started school, I encountered a lot of barriers. Years later, after I was successful in getting her what she needed, I decided to use my knowledge and experience to start an organization called Follow T1Ds to help families advocate for proper care at school, which would include all types of diabetes. Just want to be clear about that. And to compel schools to follow existing US laws that do protect students with diabetes. I'm also currently working on legislation here in Virginia with a senator to strengthen and modernize laws around diabetes care and management in Virginia schools. Thank you
Well,
for
that's
having me.
perfect. Thank you, Carrie. I am currently in Virginia, so maybe we can get together.
Yes, we will.
All right. We'll move to you, Sobia, please.
Hello everyone, I'm Sobia from Pakistan and I have been living with type 1 diabetes since 2011. I'm a diabetes advocate from Pakistan and over the years I have turned my personal journey into a mission to help others living with same condition. Through advocacy, peer support and education, I try to make life with diabetes easier and more hopeful for everyone, especially in places where talking about it is still uncommon. I also have 7 years of experience as a teacher. Being both a person with diabetes and an educator gave me a unique perspective. So during my teaching journey, I came across several students with type 1 diabetes who faced similar challenges to mine. So yeah, I'm ready to share my experience and perspective here. Thank you.
Thank you, Sobia. And it's a pleasure to have you all ladies on board, sharing your personal insights. And I will have a set of questions for each and every one. But I have noticed that each one of you has a personal story bringing you to this. And I would like to share with you also that being a mother of a daughter living with type 1 diabetes makes me understand how passionate we can be when it is somebody close to us, maybe in our home, in our family, and it is a major drive to look and seek a greater impact. So Lorena, I will start with you by asking you how do you try to educate children in schools about diabetes? How do you do that? Please share with us.
Sure. The main thing is that the kids come to school with the information they hear from their parents. So they will just say something that is inappropriate, like you did this to yourself, or oh, we can't play with you because it's contagious if you have diabetes. So we try to find more interactive ways to break down the stigma. And usually when I go to the schools, I open the floor and then the kids actually guide the conversation, because I want to know what do they know, and then I can respond to that. And if I don't know the answer, I'll find the answer. I have experience, but I don't have all the answers. So I will open the floor and I'll ask them, who do you know living with diabetes? And they'll say there's a friend in the classroom. And usually the kids are so keen to talk about their diabetes, so they come to the front and they stand with me, and then we talk about the diabetes. And that is where the game comes in, because inside the game all the information is printed on the inside and we play it in the classroom. But they also take the games, I hand them out afterwards, so they each receive a game and then they take it home with them. They play it with the brothers and the sisters and with the parents, and in a fun way, and in just by playing we teach them about diabetes. And in the classroom we also try to create fun around diabetes, so we don't go with a red pen and just make all the right marks or all the wrong marks, because it's already such a sensitive situation and there's so many misconceptions. So I love hearing what they know. And then when I open the floor, when the first kid puts up his hand, because they are, let's say, between 6 to 10 years old, when they put up their hand, the one will say, my mom's friend had diabetes. And then the next one will say, my grandmom has diabetes. And then sometimes it will go haywire. One will just suddenly say, my granddad had diabetes, but he passed away. And then you need to guide them in the right direction again, because we don't want to put fear into them for diabetes. We want to calm them down. And that is then why we use playful tools like this to get onto their level and make sure they understand that it is a serious condition, but we can talk about it openly and in a fun way.
Thank you, Lorena. I think you got everyone here interested about this game that you mentioned. And I believe there is no better way to have access to the children attention than a game. It's really interesting. We will get back to you. And I will move now to ask Sobia, from your experience and your work, what practical steps can school create or implement for a safe and supportive environment for the student living with diabetes, especially in limited resources areas or underprivileged areas? if you could share with us,
Yeah,
please.
yes, thank you for asking. So start with low cost, high impact changes because train at least one staff member on basic diabetes care and emergency response. Allow flexible snacks, inspection breaks, and a private safe space for glucose testing and insulin. And they also can have store emergency cups like juice, glucose tabs in the school office. It should be the part of their first aid kit, or maybe they can also keep it as a hypo kit and include simple diabetes awareness sessions for classmates to reduce stigma because stigma is the real problem everywhere. So that stigma so the teachers and classmates can understand what diabetes is and what it is not. The simple classroom talks or posters can replace myths with empathy. That is the most easy or low, we can low economical way we can use it. And the simple classroom talks, posters can replace myths with empathy and create a basic written plan for each child. For example, on that plan, the contact number, medicine, emergency steps, which would be given by their parents, but in a structured documents. These measures requires minimal funding, but greatly improve safety and inclusion in the school environment.
Very interesting what you are sharing with us. You mentioned the keywords, the stigma, the empathy, which are really key in a school environment. And also, you mentioned some guidelines that the schools need to implement in order to respect the presence of children living with diabetes, if any are in those schools. So we need to also mention the school policies, and there should be guidelines for those school policies. I will move now to Jyotsana. Um, we know, I think all of us know that India has one of the largest population of children and young people with diabetes. So I want to know from your perspectives and from your experience, what makes school education especially critical in the Indian context?
Thank you, Jackie. That's such an important question. And when we talk about India, as vast and diverse culture that we have so many children who live with type 1 diabetes, but the situation that they face is that the awareness travels slower than the diagnosis. So many children do not have access to the education. So many families struggled to get the right support. And since children spend most of their days in school, they learn, they grow, they form their identity in schools. But it also starts with stigma. That's the place where the stigma, the misconceptions, and the bullying that starts, and that really impacts the whole life of that child who lives with conditions. So it's very integral and important that we have education in school, and programs like Kids Program are really changing the game and making it possible to make that happen. I have seen children who are scared of taking insulin injections in school. I've seen children who don't check their blood sugars throughout the day because they don't want to be seen different. And that's a reality for so many kids, not just in India, but all over the world. And I feel that is why we need to have a very structured and proper protocols and policies in place in school that ensures that the teachers are trained, the peers are able to support the children better and not isolate or bully them because of having a condition that is something unique with them. Also, they get the right kind of inclusive environment where they can freely share and talk about and have normalized the conversations around diabetes. They don't have to feel like they have to hide it. Or, a lot of schools in India where I've seen parents that come to us in our community talking about that the schools do not take the responsibility of the child at all. Whenever a child goes through a hypoglycemia or hyperglycemia, they just simply call the parent and ask them to come to school and take their child away. So I feel like schools really need to have some trained support staff to help the child so that the child can freely learn without having to lose that many hours and so many days sitting at home and managing their condition. And it should be a collaborative approach and opportunity where caregivers and support staff and everyone involved equally takes the responsibility of the child and help them to really thrive and grow better and have the right to learn in school without having the fear of going out of the school because of their condition.
That's very interesting. You got my attention specifically when you mentioned awareness travels slower than diabetes. This is really an impactful sentence. Thank you for sharing that. And I would like to mention you spoke about the limitations in schools, and this is actually one of the targets of the kids program, to train the school personnel to make them understand better how to deal with children living with diabetes if they have them at school. And you're simply by your testimonials letting us know more and more how important this kids program is. I will move now to Carrie with my next question, and this time about the parents. Why do you think parents need to continue advocating um, for students with diabetes even after their kids leave the school and their own child will not maybe need uh, anything at that point? Why should they continue to work on that transition and the self-care at school? And I know from a perspective of a parent that it will never stop. My passion for the topic will never stop. But from your experience, why do you think they should continue to do that?
Thank you for the question. This question really defines what I'm doing, why I'm doing what I've been doing for the last 2 years. I just believe that advocacy doesn't end when you finally get what your child needs. That's where the battle you've won can truly help others from having to go through it again. And as Mr. Wang said earlier, we need to hold that umbrella for others. When one parent, finally secures the needed supports at school, like I did for my child, those changes don't often go through the school or even the school system where you are. Lots of times schools will quietly help you change things for your child, and other children will continue to be denied the same accommodations, which did happen in my situation. I had to hear lots of people were getting denied accommodations. I had fought years to have my school support for my daughter, and it almost felt like privileged diabetes care, and it really upset me. My daughter shouldn't be getting accommodations that other children can't get just because I was able to and had the time and really the emotional capacity at the time to advocate for her. And not everybody has that, especially with a new diagnosis. And so I felt really passionate about trying to use the knowledge that I had gained to help prevent other parents from having to fight the same battle over and over again. That's why parents, have to keep going. Because until schools make meaningful long-term updates to how diabetes care is managed, we're the voice that's going to continue to drive the change. And the parents who've been through it, we know what works, and we know where schools are falling short and what needs to improve. But on top of that, I want to say, I'm very aware that, as I mentioned, not every parent can speak up. Some parents have health conditions of their own. They're still learning to manage diabetes. They have other children. They have jobs. They're overwhelmed. And a lot of times they don't even know what their rights are, whether it's local or state or country. In those cases, it also sometimes does fall on nurses or other school staff that see these same gaps in care that the parents do. And sometimes they're the best advocates for the students at school. And programs like the KiDS program certainly empowers school staff to speak up for those children when maybe their parents can't. And so I just think, as we've said several times, we all need to work together. We all need to be educated. It shouldn't all fall on the parents. Sometimes they are not the best advocates for their kids and they need help. Thank you very much for that question.
Yeah,
I could talk about that for hours.
Yeah, I see that and I feel it myself because we as parents have this passion. But as you mentioned, some of the parents maybe don't have all the settings ready for advocacy. We need to help them. And maybe not all of us are meant to do this. So those of us who can do it should definitely go on with our mission in life. And one interesting point that I would like to mention that that, as it seems, the challenges are not only for us living in low middle income countries or underdeveloped countries. It seems the program, the challenges go across the globe in different ways. So this is interesting to see, and it gives us a push to keep working, but especially for those who live in underprivileged areas in humanitarian settings, we need to work definitely harder in those areas. I'll come back to you, Justana. I keep pronouncing your name wrong. Sorry for that. And you know I love you, so no offense for the name. So, can you share some examples of what you use, like games, storytelling methods, or any other creative approaches? We need to be creative with children. So, what do you use in order to capture the children attention during the sessions that you do?
Absolutely. And I think, as Lorena said, games, storytelling, these are very important tools that really can change the whole game of diabetes education, because we don't want it to be like in a lecture one-way format. We want the children to really learn, understand, and also the sports staff and parents to get a fully deep understanding of the concept without making it a boring lecture. So when we started doing it back in 2018, so I got the opportunity to attend one of the camps of League of Diabetes, where I learned very different types of games and activities that we can do. So one of the famous ones that became viral overnight was the Insulina dance, which basically is a dance which kind of tells you how to change your injection sites. Then I tried including storytelling as part of these sessions, where we have like the adventures of Beta and Sugar. There's a game that I prepared that helped people to understand, okay, that pancreas is your king, insulin is your helper, and then your blood sugar levels are the challenges and the villains that you have to face. And I think this really helps to make the diabetes education more fun, intuitive, and children were able to go back, teach them to their parents and learn it. And I found it very useful to teach it to parents as well, because they were able to understand it better. It was like a fun and light session, and that really helps to kind of reduce the stigma as well that comes, that this is like a serious disease and you only have to talk about the negatives of it. But if you can make it a little more fun, intuitive, creative, I think it adds a little empathy, it adds more understanding, and it really helps to connect people from each other. So we have role playing that we can do. We have the Insulina dance and different games that we do. We do storytelling. And of course, there are more creative ideas, like Rudina said that she has created that in game that to play. So these are some of the things that we've been using, and definitely the kids program has some amazing resources that we can definitely use and can help us to further strengthen our efforts in spreading education and awarenesses.
Thank you so much for that. And as you can see, even arts play a role. So I love the idea of the dance, and maybe we can do another session where you teach us that dance, and also Lorena can tell us about the game, and we can have more interaction about this, because the more creative we are, the more impact our sessions will have on those children. And now, not the so pretty side, if we want to talk about challenges, Lorena, I would like to know from you, what is the most difficult part, like a big challenge that you've encountered for the diabetes awareness and education in schools?
Thank you for your question. There's quite a long list, but I won't keep you here for hours. Basic things like just general knowledge about diabetes is very low overall. And unfortunately, there's a quote that says, no one gets it until they get it. And with any condition or anything in life, that is the reality of the case. But small things like kids not being allowed to take their phones to school to check their glucose with their sensors, during exams where kids experience low blood sugar, where our endos recommend a 45-minute recovery period before they continue with their test. Nothing of that is in place in not only in our country, in many parts of the world, but that is the bigger problems. But then because diabetes is not a visible condition, people forget that it's there all the time. It's not like a broken leg where you see the broken leg, or you see someone is sick with a tummy bug. It's in the background, yet it's in our faces all the time. And for people around the person with diabetes to understand that, especially if they are 6 or 7 years old, the child don't even understand all of it already for themselves, and now they need to manage the people around them as well. So there's so many little things, like I said earlier, where people think it's contagious, or you can't invite a child to a birthday party because they have diabetes. That causes the guilt and the judgment and the shame and all the bad isolation and negative thoughts and emotions that comes with it. So there are so many different challenges, and because the kids are small, you don't want your child to live in guilt from the age of 4 or 5 years old, because when will they ever shake that off as they grow older? They will just go into the shells and start hiding and not being part of the community around them. So from the smallest little issue, like what's in your lunchbox if you go to school, if you live with diabetes, to the much bigger problems like not being able to complete an exam or to deliver your best because you are experiencing low blood sugar while you are writing a test, or you need bathroom breaks because you are stressed, your blood sugar is high while you're doing your exam. There's so many misconceptions, and it's like this gray area. People hear diabetes and they just think, oh, don't eat sugar, that's the end of it. But the emotional side and how it affects you in so many different ways, it's neglected, not only in South Africa, across the world. And if we can put more visibility onto all the invisible parts of diabetes, I think we can make a big difference globally.
Absolutely, absolutely. And you, by the way, you tackled my next question about the misconceptions.
Okay.
Thank you for that. So I'll move
Sure.
on now to Carrie, and would like to know from your experience, what are the biggest barriers for the students with type 1 diabetes, and what do they face in accessing safe and equitable care in schools in the United States particularly, so we can compare what's happening between different countries?
Well, fortunately, I only know about the United States, which is why I love all the work I've been doing with Blue Circle Voices and learning about your programs. It's really important for me to learn what the state of diabetes is in all countries. I think we all piggyback on each other. And so while I understand in the US, we do have a lot of laws, and we have lots of national organizations that help with diabetes advocacy and awareness. We still have problems. They might not seem like problems to a lot of countries who have really significant issues. So I just want to be mindful that I am talking about the US perspective, and this has no bearing on whether or not, I'm disregarding that we do have it much better than a lot of other places. So I just want to be clear about that. In the United States, we have federal laws like the Section 504 of the Rehabilitation Act and the Americans with Disabilities Act. They require public schools to provide equal access and accommodations for students with medical conditions like type 1 diabetes across the country. So like I said, I realize this is not all over, but in the US, these are the laws that we deal with. And, I'm not aware of, and I'm not saying that it doesn't exist, but I'm not aware of the KiDS program currently being used in the US. And, we do have national organizations, like I said, that have advocacy and, training manuals and such that can be passed around to schools. But the education piece is really lacking. As I said, I'm working on legislation in Virginia. A bill that I helped work on last session is in a study, and it contains information about all types of diabetes, signs and symptoms, and type 1 diabetes autoantibody screening. This law has passed somewhere between 8 and 11 states. It's a little fuzzy. I think it's around 11. And I'm hoping Virginia will be the next one this next session to pass that law. That would require schools to put information on their websites about type 1 diabetes and screening. And I think that's wonderful. But even with that, we don't necessarily have like an on-site education program like what KiDS is trying to do, where you want to educate schools and parents and students about diabetes, like management and how it needs to be implemented into the schools. And lots of kids are watching other kids give shots. We should be explaining to these children, why is this child giving themselves a shot or pricking their finger or eating candy in the middle of a test? That information is not included in this the bill that I'm working on. It's really more for safety and overall education about diabetes and stuff. So I think that while we have these laws to protect our children in the US, the reality is that a lot of schools either don't understand what their legal obligations are or they deliberately choose to ignore them. So instead, they will rely on outdated policies that not only violate the law, but they also continue to create barriers for students in accessing their education. So this leaves parents to do all of the work, as I had stated before. So there are lots of barriers, but education is definitely one of them. And then having schools be willing and accountable to following the laws and updating policies.
Thank you so much for sharing this, but you are tackling a very important point, which is policy advocacy. And this is very important because without proper policies, we cannot implement anything in any country. So I call upon all of you to approach your ministries to try and work for favorable policies in order to have the facility to implement the kids program in more, at large, if we want to say that. And Carrie, you could easily adapt the kids program and use it in the US, as it is very nicely tailored and easy access, and it's there. You don't need to work on any material. The material is already there and very accessible. And as you mentioned, even in the US, a very developed country, you face some challenges. So let's go now to Pakistan and know from Sobia. So how do you think teachers can be better trained for kind emergencies like hypoglycemia during the school hours? And at the same time, how the initiatives like the kids program can be adapted to different cultural contexts, like, for example, in your case in Pakistan, for a better and impactful outcome?
Thank you for asking. Okay, during my teaching career, I came across students with type 1 diabetes who were struggling because of their environment, especially the environment available in Pakistan. I also saw how students sometimes hesitate to inject insulin at school because they don't have private safe place where they can inject themselves. They were also hiding their condition because they were afraid what others will going to say about them. So this shows why we need clear policies, awareness among staff and facilities to support them. So in every school training of teachers, it is a part of the system. So we can integrate short practical diabetes related modules into regular teachers training. And teachers training should not only teach what to do, but also how to respond without judgment. Stigma often grows when teachers or peers panic or react negatively during the hypo episodes. So if the teachers will going to act negatively, it means the whole classroom will going to react in that way, right? So in practical scenarios based sessions where teachers learn both the steps and sensitivity help build confidence. So the teachers need to learn hypoglycemia symptoms, recognition, immediate steps, that what they have to do if the student is showing the symptoms, and the basic prevention strategies. So they can allow them free time to have a little snack during the class so they can avoid their hypoglycemia episodes. Yes, and also in their training, we can use role play, quick references cards, posters in staff rooms with specific instructions on it about hypoglycemia and their medical emergencies, and maybe the annual refreshers. Also, peer-led workshops with a local diabetes educator on an experienced parent can be low cost and very effective in the countries like mine, Pakistan. So adaptation requires local partnerships and flexibilities. Co-design materials with local teachers, especially the teachers who are also living with type 1 diabetes. So because they know better about this condition, and the parents and the people with lived experience. All the materials available would be in translated and culturally localized, which has culturally and localized stories and examples. Offer both low tech, for example, they can provide posters and role plays, and high tech, maybe the online modules available for for the teaching or as a course. Options depending on the resources but are available. So pilot in a few schools and use feedback loops to refine this program. So and embed monitoring. So impact is measured and best practices are shared across region. So these type of practices can be spread across every region, not only in Pakistan, but also all the countries which are like this, where this type of awareness or educational sessions are still required.
Thank you so much, Sobia, for sharing what's happening in Pakistan with us, as it is very important to have to know about the challenges and at the same time the success story of how the kids program is being implemented. Now, we heard about how policies are very important to maybe minimize or eliminate, if possible, the discrimination and the stigma. I would come back to you, Jotana, to ask you, how can ministries of education and health work together to ensure inclusive, stigma-free environments for the children with diabetes across India? And maybe that can be implemented in other countries as well.
Thank you for that question. And, while Kerry was saying, I feel that policies are truly game changers, because while awareness shapes the mindsets, policies shapes the behavior and accountability in people. So it's very, very important to have that in place. And when I talk about country like India, we have already seen some small little policy shifts that have been happening in collaboration and collaborative effort of the diabetes educators, the advocates, caregivers, healthcare professionals. So earlier in India, children and adolescents were not allowed to take hypo snacks or wear any glucose devices during exams. So now, through this collaborative efforts and in collaboration with the National Commission of Child Rights and Protection, they have issued a statement and a letter that have allowed children to now carry the hypo snacks. They can wear their CGM devices. They can do their monitoring and everything within the exam hall and in schools. So I feel that it is possible when we all come together. And it was a very small policy change, but had a big impact, because it was a very pressing issues amongst the families in India and children who were not allowed to take hypo snacks during the examination. And I feel that it's very important that children in India right now depend on the goodwill of teachers and principals, and that shouldn't be the case. Policies should be non-negotiable, and inclusion should be non-negotiable. When we talk about that, we need to have a culture where diabetes education is considered as normal as having nutrition and sports in school. And I feel that is possible, and that should be the the next goal for all of us, considering the load of diabetes, especially in India, which is the epidemic of in India. So I feel that we need to mandate the teacher sensitization so that we provide safe spaces for medication and even flexibility during exams like just happened. And to make that progress more sustained and more consistent, we need to have proper policies in place. We need to have proper standard protocols where health ministries, educational ministries can come into place. They can provide the medical frameworks. Educational ministries can embed that into school curriculum, have a teacher training program where every teacher, every school should have a nurse and a support staff to support the child living with diabetes, so that they get that inclusive environment and they're able to feel comfortable and confident with their condition, and don't have to be ashamed or have the fear of hiding their condition. And we would be able to reduce the stigma that is long standing with diabetes. So
well, thank you for sharing that. I can see the similarity in the challenges and the good side of the impact shared across countries. We can share challenges, but the happy part is that we share also the success stories and we learn from each other. And from what I see in the chat, we have so many countries participating today. I would like to finalize with a very short message from each one of you, my dear ladies, and thank you for all what you shared with us. So, Lorena, very short message. What would be your closing statement?
Thank you so much. I think we forget the work that we do. We can't always see what we are doing, but nothing is for nothing. So each little step, whether you receive feedback or not, you are making a difference, and never stop doing what you're doing, because if there's a need that you are feeling, then there's a need someone else is feeling as well. Just keep doing what you're doing.
That is amazing. Thank you. Jyotsana, final
So,
statement?
yes, so I would say my vision is that in no child, whether in India or anywhere in the world, whether that child lives in a metro city or a rural village, should miss school, should feel alone or isolated, or risk their health because of lack of awareness and education in masses. I feel that diabetes education should travel the same road that children take to go to school, reaching every corner of the country, and which is carried by empathy, inclusion, and hope, because no child deserves not to have the right to learn. And through KiDS program, through IDF, and all the other stakeholders involved, we can make that possible.
Great. Thank you so much, Carrie.
I guess my final parting words would be that I really want to emphasize that parents can have a real impact on how schools and laws evolve to support students with diabetes. The technology and management of today is moving exponentially faster than at any other time in history. And when parents can create the urgency by clearly expressing where schools are falling short in supporting diabetes, that we really do help drive policies and protocols and laws. And I think it's very important to use your voice.
Thank you so much. Sobia?
I know that designing a program that can be implemented everywhere in the world takes time, but what's important is that program continues to evolve. But I mean, we have to take one step at a time at our place and our country. Just keep doing what you are doing in making school safe space for the kids. Like I always say, while we are raise our voices, they often don't reach everywhere. So we need each other to amplify our voices so they can be heard everywhere in the world. Thank you.
Thank you. You've heard the powerful messages from our panelists. I would like to, this webinar is coming to an end right now, so I would like to thank you all, thanking our wonderful keynote speakers, our panelists for the insightful presentations and inspiring discussions throughout this session on healthy schools, healthy futures, and the KiDS program in global diabetes education. Your experiences and dedication truly highlight how education can shape healthier generations and empower children, parents, and teachers to understand diabetes with empathy and knowledge. A heartfelt thank you to all of you and to everyone who has joined and who has attended this webinar from wherever you are joining us. From all over. I've seen the countries and it's so exciting to see. Hopefully you can share what you learned today, your takeaways from this session in your own countries. And again, to finalize with the housekeeping, once again, that the recording and slides will be shared along with the feedback. Please make sure you fill out the feedback questionnaire, as it is one requirement to obtain your certificate of attendance as well. And please respond to the feedback about helping us improve future IDF online events. We want to know what you think. We want you to enjoy the sessions we prepare for you, and we care for your opinion. So please do not fail in responding to the questionnaires, and send us any questions you may have to kids@idf.org. With this, I believe we come to the end right on time to this session. I would like to thank you all once again and look forward to seeing the KiDS program disseminated across the globe with your help. Thank you so much. Bye-bye.